detail about vaccine pre-positioning plans. The plan is to vaccinate those who are at high risk, including those who work in long-term care facilities, nursing homes, and other congregate care facilities. Healthcare workers and first responders will be targeted first. Perrysburg, Ohio, Eagle News. I'm Ronnie Bayuga. We live in interesting times. Back to you, Ace.
Ronnie, you mentioned 3%. From 3%, it jumped to 11%, and now it's at 13%. We can't blame the government for imposing such curfew.
No, we cannot. And the issue is people were gathering together for parties and family gatherings without wearing masks. So as of last week, actually, Governor Mike Dewine had suggested that we will have a limit now to free open space gatherings. So what that means is that if you're in a, let's say, a large conference room or building, you cannot have people walking around and gathering together. They must all be seated. This was actually signed yesterday to law. So that is an actual, they're trying to prevent people really from contacting each other.
And that's aside from reducing the capacity.
Correct. That's aside from reducing the capacity of venues. So, but Governor Mike DeWine is also trying not to shut down the state, trying to make sure that businesses continue. He did 3 weeks ago request for at least $5 billion to help these businesses out because that money's gone already. They've already issued quite a bit this year.
Wow. Well, going back to your to the curfew, what's the penalty for violators?
Penalty is very stiff. You may get a 90-day jail sentence or $750 fine just for violating the curfew. So if you are out and you're not going to work or you're not going to an emergency or getting food, you may be fined $750. That's going to be a really expensive dinner.
Exactly. How do you intend to spend the holidays then? If there's
it's very scary, right, Ace? We've heard a lot of news about issues with wedding receptions and things like that, and families, including there was one here in Cincinnati where 32 out of the 83 guests in their wedding were infected. So these were all family members, grandparents and grandchildren, aunts and uncles. They were all infected. So it's scary to try to invite your family. It's not so much that they might infect you or you might infect them unintentionally. So things like that, we're here between, I'm in Ohio and my family's also in Michigan. Michigan themselves, they saw 48,000 increase last week in COVID cases. So there's a lot of other things going on. Yeah, and my kids' schools right now, 2 weeks ago, they had started 4-day school week, in-person school. Wow. And last night they canceled it because they also had a significant number of their students in their junior high that were now in quarantine.
That is indeed a very tough decision for the government officials to make. But we've discussed this over and over again. Health is always the priority.
Yeah.
Thank you so much, Rani Bayuga from Perrysburg, Ohio. When we come back, an update from Delano, California, a hike trip in Gaithersburg, Maryland, and a cooking class in Killeen, Texas. Eagle News America will return in a moment.
Hello there. Imagine Demi got the virus, and she infected 2 more. And those 2 infected a lot more of people. And it goes on and on until it became an epidemic. But what if Demi stayed at home? Then those 2 wouldn't have contracted the virus. Then those people would have not been infected. This is not just your battle, it's everyone's, and you can be a huge help. Follow social distancing, or better yet, stay at home.
Hi everyone! Net25 Kids is inviting you to EBC Webinars 2020, a series of educational and informative webinars for teachers and parents, which will be live-streamed via Net25 Kids' YouTube page. We will be featuring several guest speakers with years of experience to share information that would be valuable and helpful for teachers and parents as they educate and manage their children in these interesting times. Hope you will join us! For updates, schedules, and more information, please follow the Net25 Kids Facebook page.
You are watching Eagle News America. I'm Ace Ramirez in Washington, D.C. More coronavirus news. Los Angeles County issues stricter restrictions as a record number of COVID cases beleaguer the whole country. In Toledo, Eagle News correspondent Julian Fiesta has the story.
Thank you, Ace. With rising COVID-19 cases and hospitalizations, Los Angeles County issues new restrictions and safeguards effective Friday. For the protection of public safety and health, county officials updates the Public Health Office order to include tighter measures. 25% indoor capacity is the maximum limit for non-essential businesses like retail stores and personal care services, and 50% maximum outdoor capacity for restaurants, go-karts, mini-golf, and batting cages. Angelenos must have an appointment to receive services at personal care establishments with both the customer and staff wearing face coverings. Services that involves the removal of face coverings like facials are not allowed under this updated order. In addition, personal care establishments are prohibited from serving food or drinks. Restaurants are not allowed to operate from 10 p.m. to 6 a.m., so Los Angeles residents will need to plan accordingly when purchasing dinner at their favorite food places. Gatherings of any kind must remain outdoors with a maximum of 15 people and no more than 3 households. These updated orders will be enforced this Friday as Los Angeles continues to experience rising numbers of COVID-19 cases and hospitalizations. Dr. Barbara Ferrer, the LA Public Health Director, states, quote, "Los Angeles County is at a critical moment to save lives and curb the spread of COVID-19. I urge our residents, businesses, and community leaders to heed this warning and follow these heightened safeguards so that additional restrictions do not need to be imposed." County officials have plans in place should COVID-19 cases and hospitalizations continue to surge. Once the 5-day average of positive cases surpasses 4,000 or hospitalizations are over 1,750 daily, the county will order the closure of outdoor and indoor dining, with the only options of pickup and delivery. But if the 5-day average of positive cases surpasses 4,500 or hospitalizations are over 2,000 daily, the Safer at Home order will return and be enforced for 3 weeks. The only ones to be exempt are the essential workers and those on essential services. In addition, there will be a curfew enforced from 10 p.m. to 6 a.m. Angelenos are hopeful that it will not come to this point. In Delano, California, Julian Fiesta, Eagle News, we live in interesting times. Back to you, Ace.
Julianne, that report, it sounds like, and coming from Parisburg, Ohio as well, it sounds like we're going back to March, April, right?
Yes.
What does the recent data say about COVID cases among younger people?
So in the last month, the rate for 18 to 29-year-old residents has increased from 11.5 cases to 25 cases per 100,000 people. That's more than double the previous numbers. Cases for 30 to 49-year-olds have also risen from 9.4 to 18 cases reported for every 100,000 people. These numbers point to an alarming trend among the younger residents. Ace?
Does this increase in the cases among the younger population have any bearing on the elderly? How does it affect them?
So unfortunately, it has a damaging effect on older residents. People 80 years older are part of the age group known for having serious illnesses. So as younger people continue to contract and spread COVID, the elderly will suffer the consequences.
That's scary. Let's talk about ethnicity. Are rates of COVID cases disproportionate in LA as they are in other parts of the country?
So in LA County, the Pacific Islanders, Latinos/Latinx, and African American/Black residents in every age group are the ethnic groups that have consistently been reported as having the highest rate of hospitalizations. And as cases begin to surge once again, health experts predict that disproportionate rates of COVID cases will once more manifest. Ace?
All right. Well, be safe over there. Julian Pesta from Delano, California. You know, yesterday was National Take a Hike Day. And EBC friend Eliza Gonzalez Manglikmot shares with us this outdoor adventure story on why we should explore our neighborhood trails and take advantage of the simple and lovely treasures you just might chance upon. Let's take a look.
Welcome to my favorite part of our city, the Seneca Green Whale Trail in Gaithersburg, Maryland. This neighborhood trail is a 2.5-mile moderate level hike path nestled in the heart of this suburban city. Every time a walk opportunity presents itself, I grab it and put on my hiking boots. A 30-minute to an hour of walking in this serene refuge resets and recharges the body and the mind for everyday tasks that await me. And when I'm here, some walk friends who don't really require any form of verbal conversation greet me every few meters. This is a box turtle. I have named him Raphael. You see his kind on the trail most of the time. This is Anne, and I make sure to walk around her every time I'm here. You know, respect for her space, so she'd respect mine. This is Leggy. Oh, don't worry, she's very friendly as long as you don't poke or tease her. This is Paro. Isn't he beautiful? And these are the Brown brothers. They are mainstays here. So you see, spending a very small portion of your day to say hi to these neighborhood friends in your neighborhood trail is worth every second. Just always remember your trail etiquette or hiking guidelines. According to the American Hiking Society, here are some reminders when out there enjoying nature. Hike quietly. Take advantage of sounds and respect others by hiking quietly or speaking in a low voice if there's a need to talk. If you packed it in, pack it back out, even if they are biodegradable items. Non-native foods are not good for animals to eat. If you are hiking downhill, you yield to those hiking uphill. Do not feed the wildlife. You do not want to mess with their natural foraging habits. The only things you should take with you are photos and memories. Leave what you see there unless it's trash. And Be a good citizen to toss it away when properly able. Walk through the mud or puddle. Avoid walking around it. This will help preserve the trail by staying on the trail. If hiking with the group, avoid taking up the whole path and allow others to pass. And because we are living in pandemic times, don't forget to wear your mask if crossing paths with other hikers and observe social distancing. So, make no excuse. The trail is waiting for you. In Gaithersburg, Maryland, Eliza Gonzalez Manglikmot, Eagle News. We live in interesting times.
Eliza, that's a good report. How come I never get an invite? I'm like 5 minutes away from you.
Oh, sorry, Ace. That's why when you go to the trail, you have to be quiet. I cannot take you there.
Are you saying I'm loud?
Next question, please.
Okay. Well, during this pandemic, how often do you go hiking?
Well, Ace, when restrictions in using public trails have initially eased, that was a few months ago, I decided to go back to hiking after months of sheltering in place because we all fear getting infected by the virus when out there, even on the trail. So I would say now an average of, I try once a week, I would make it a point to visit the hike trail right next to where we live.
That's good because Maryland, this area, the DMV area is very rich in this natural resources, in these trails, these state parks as well.
Correct.
What have you observed comparing from during the pandemic and pre-pandemic?
Oh, pre-pandemic times, these hike trails are usually busy. Here in our area in Gaithersburg, Maryland, now that we're in a pandemic time, hikers are pretty much compliant with the use of protective face coverings and respecting safe distance from others. The distance we are advised to keep from each other. So more often than not, you see other people on the trail putting on their masks when they're about to cross paths with fellow hikers. But in some rare instances, Ace, there'll be one or two that you'd see not wearing masks. But the trick is, I've learned this, you look them in the eye and you widen your eyes like this. So you're wearing your mask and you widen your eyes like this, like asking them without saying, how come you don't have a face covering? So, and they usually, in an instant, pull up their shirts like this and put them over their mouth and nose. So just a gesture of, okay, we're embarrassed, we're sorry, and then they walk past you. So you have to use the glare.
Yeah, but now that there's a surge, there's a spike again in coronavirus cases, how do you think will this affect the use of trails?
Well, it's because of the recent spike in COVID cases, not just in Maryland, not just in the country, but across the globe. Some trails, especially those that are usually busy with hikers or runners or bikers, they might be temporarily closed. But also in an effort to do our part in mitigating the spread of the virus, I think it is wiser to stay at home if there's not really any essential activity that you need to do. Unless hiking to you is essential, then maybe in your area, if outdoor activities are still okay to hold, it's best to check your counties or cities' public trail websites to find out which ones are open with restrictions and which ones are totally temporarily closed for the time being. Ace?
Okay. Well, thank you so much, Eliza Gonzalez Manglikmot from Gaithersburg, Maryland. The next time you feel the itch to hike, I'm 5 minutes away, okay?
I'll keep that in mind.
All right. After burning calories during that hike, let's reward ourselves with something good. EBC friend Jennifer Valerio invites us to her kitchen in Killeen, Texas, and shares with us her simple 5-ingredient spicy ahi poke. Oh yes, the 5 ingredients for this yummy treat. Let's take a look. That looks yummy. Our virtual roundtable discussion about National Family Caregivers Month, that's next. This is Eagle News America. Stay with us.
Tissue boxes mo. Hindi mo ba alam, mauubos daw ang mga tissue products? Bakit naman? Ang raw materials daw ng mask at tissue products ay iisa lang. Saan naman galing ang balitang yan? Ay basta, narinig ko lang din. Maraming diling kayang nagpo-post sa Facebook at Twitter, kaya kung ako sa'yo, pumuha ka na din. Sige na't mauna na ako sa'yo
Huwag basta-basta magpaniwala
sa mga nakikita.
Una babasa sa social media.
Magsaliksik at i-verify ang lahat ng impormasyon
Nakukuha sa internet.
Tandaan,
Maging responsable tayo
sa paggamit ng social media
nang hindi magdulot ng panic sa iba.
Kung paanong dapat labanan ng COVID-19.
Ay gayon din ang ating pagsugpo.
sa black propaganda
At maling impormasyon.
Dennis Lu,
Lou Omelda,
Regional Partosa,
Tyranel Pililu.
Hannibal Arevalo,
EBC,
Japan Euro. We live in interesting times.
Are great.
Wow, galing.
Effortless.
That is your moment.
Isang spot na lamang po ang natitira para po sa ating third monthly finals. Sino kaya sa ating mga kalahok ngayon ang makakasama ni Dexter Nicolao, Elizabeth Leiva at Chito Recafrente para po sa ating last spot sa monthly finals? Sama-sama natin alamin sa biggest talent competition of Philippine TV and online. Ito po ang Tagis and Nicolay Part 2 Sing Edition!
November is National Family Caregivers Month, and tonight we will recognize their efforts and dedication in caring for family members or friends despite not having formal training to provide such service and also not receiving any compensation for doing it either. According to the CDC, informal or unpaid caregivers, these are family members or friends, are the backbone of long-term care provided in people's homes. Mental Health America states there are over 53 million Americans who are unpaid caregivers to family, friends, and neighbors. Tonight, for a virtual roundtable discussion, we will give shout-outs to these superstars and heroes in our lives. Let's start with Julianne. I told you I'm going to ask you first. Julianne, do you know anyone in the family who is considered a family caregiver?
So I know our moms usually have their hands full with us as kids. But in addition to that, I had my grandma on my dad's side, as well as my grandma on my mom's side, stay with us for a good amount of time, for a couple years, I'd like to say. And my mom took time off work to take care of them because my grandma on my mom's side, she had a disability, and so did my grandma on my dad's side. So she really took the time to stay home, become a really stay-at-home caregiver, despite not being paid, like you said, and not having any of that formal training. So I just want to give a shout out to her for working hard, taking care of both of them, and taking care of all of us in this family, because me and my sisters are also a huge handful.
Do you remember how were you able to thank them? Any special way?
So every now and then, since my mom does take care of us, we do try to do little things for her, whether it be just doing chores without her asking us, or maybe making her food when she's tired, when she's taking a break, and other times just leaving her alone and giving her that peace and quiet that she needs away from all of us and the loudness of having 3 girls.
I think that's good enough. Thank you for sharing, Julianne. Let's go to May Ann. Hey, Ann. Okay, share with us any family members who are considered family caregivers.
Yes, Ace. We do have, and that's my Aunt Rose and my cousin Agot on my mother's side. So I also want to give a shout out to them for taking care of my grandparents, my Apong Lakay, my Apong Bakat, when they were still alive. And as you mentioned earlier, they didn't get any compensation. They didn't get any professional training. So they also opted not to get any professional or paid helpers. They just wanted to take care of my grandparents, and because they were also the closest in terms of proximity to my grandparents during that time. They were basically neighbors, so they would go to my grandparents' house every day, like in the morning, see what they're doing, prepare their food, and all of that. And also other close relatives would pass by, would come from time to time to help them. But it was basically just my Aunt Rose and my cousin Agot. So as Jillian mentioned, it wasn't easy. They have their own family to take care of, but I guess it's really, or I believe it's part of the Filipino culture, right? The close family ties, and we do it with all of our hearts, love, and we labor for them without any compensation.
At the end of the day, just come to think of it, how were we able to survive, or how could we have survived without them, right?
Right.
But let's ask Rani. Rani, what do you think? Who do you consider a family caregiver?
Ace, I currently I haven't had that experience yet in my family just yet. But my friend, Dan and his wife Megan, their mom had a heart attack, a stroke, and so they had to take care of their mom. And it was a very trying time for them in the beginning, because they chose to take care of her at their home, and like May Ann said, we as Filipinos, we take care of our family because they took care of us when we were kids, so it's now our turn to take care of them. But it was trying times, and a lot of times, for Dan, it was just a good time for him to come to me, and I would just listen to his struggles with it, and it was an emotional thing also. But they saw through it and they pulled through after a while of getting used to it. But we really do have to have our hats off to them for taking good care of their parents.
That's right. I agree. Totally agree. We owe them a lot, actually.
Yes, we do.
Let's hear from Eliza. Eliza, you have your own story about the family caregivers.
I do. I'd like to give a shout out to my aunt. She's my mother's sister. Her name is Erlinda, or better known as Inday in our family. We call her Aunt Inday. She took care of our mother when my mother had a stroke. And if you see there in that photo, she's there. She's so tiny compared to my mother. I think she's only like 90 pounds or even lighter. But she insisted on being the top caregiver for her sister. And when I say top, she was on top of everything, like over the top. She knows my mother's routine, the schedule of her taking her medicine, her meal times. And she did this for how many years without asking for any compensation at all. And when my mother was laid to rest, we had a chance to ask our aunt why she did what she did. And all she said was, she's my sister. That's what family does. Family takes care of family. So to all the aunt and dies out there, a round of applause. Thank you for everything that you do. And to you, Tita Inge, not just for taking care of my mother, but also taking care of the whole family. Yay to you, yay.
Speaking of, I consider my mom as a total family caregiver. Took care of my dad when he was sick, took care of my grandma when she was sick, and totally selfless. Mommy, I'm coming home soon, all right? After the pandemic, I will. All right, we continue to thank our healthcare workers, first responders, and essential workers with a round of applause. That is today's Eagle News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.
Sa mundong waring walang puwang para sa kanilang pagmamahalan, sapat ba ang tibok ng kanilang puso upang bumuo ng sarili nilang daigdig? Inihahandog ng Eagle Broadcasting Corporation ang kauna-unahang romantic drama series ng Net25. Ang daigdig ko'y ikaw. Magsisimula na ngayong Nobyembre, tuwing Sabado ng gabi, dito lamang sa Net25. Abangan.